Hi all, my name's Chris. There are a number of patterns that I teach clients in my Pilates studio very frequently, and I keep getting asked the same thing again and again, so I'm going to put a video online so that you can just check in with that if you need to. There are obviously many possible causes for lower back pain. One of the things I wanted to talk through today is one of 4 things that we're going to talk through over the next few days. I'm just going to give you a video for each one that are really common ways that the muscular system can exert force in through the lower back and make things uncomfortable and cause lower back pain, or at least make some structural stuff going on a little bit worse at a sensory level. So if you are sitting in a desk for a significant chunk of your day, sitting driving for a significant chunk of your day, then it is quite common to get either shortened through the front of the hip or overactive through the lower back. So the very first thing we're going to do today is look at an exercise that we call the lumbar flexion stretch. It just means lumbar lower spine forward bend stretch. And it's a super gentle way to do this release through the lower back. Now, if you've got current disc pain or you've got neural sensation coming down the back of the leg, this stretch is not for you, not at the moment. May well be a very useful thing to do down the track a little bit, but we don't want to go there yet. All right, so the very first thing I want you to do is actually test. Do the movement intervention and then test afterwards. So the very first thing you're going to do is lie down on the floor, on a mat, whatever's comfy, whatever you've got, just lie down and you're going to assess what's going on. In the lumbar spine, there is a natural inward curve. You're going to take one hand, slide it into that lower spinal area. You should be able to just fit your hand into that lower spinal area. Right? If you've got a large gap, like this kind of thing, there's too much curve there, right? So I want you to, now, you're going to test how much space is there at rest with my legs out straight, right? If this is jacked up in the air somewhat, there are really 2 muscular structures that could be at play here. And we're going to look at the first one today. It's actually your lower back muscles. If they're overly tight, they're pulling you into a back bend and they can often cause discomfort. So you're going to take a foam roller if you've got one. If you don't, you're just going to grab a towel, roll it up into what we call the spa towel configuration. You can use 1, which is what I've got there, or 2 to get a little bit more height. And you're going to place the foam roller or towel underneath the back of the pelvis. You're going to fold the legs in towards the body, hug the knees gently in towards the chest. Now, you're going to take a deep breath in. Hold for 5, 4, 3, 2, 1, exhale, relax, lower spine drops towards the ground. Now as we breathe in, obviously your lungs are up in the rib cage, you don't breathe into your lower back, but as your lungs expand, the breathing diaphragm descends and puts pressure through all of your organs, and we are using that force couple to just put a little gentle pressure, stretch pressure through that lower back. So you're going to block the movement of the abdominal wall, which is where we will move most easily, and you're going to disallow movement there, and we are going to breathe focusing on moving into the lower back. So I'm going to send my lower back towards the ground on the inhale. Hold, 2, 3, 4, 5. Exhale, relax. And I want you to do that 3 to 5 times. And then once you've done that, you're going to bring the feet down, take the roller or towel out of the way, straighten both legs out, and reassess. Is my lower spine relaxed and a little closer to the ground? If so, then this particular muscle is contributing to that exaggerated lumbar lordosis and maybe contributing to some of your lower back ache or pain. I'm going to go over the other elements of this in the next few videos, so if you want, swing on to the next video. It'll be there in a couple of days' time.